Welcome to Break the Rules with Dr. Lauren Lax, a podcast dedicated to quieting the noise in the health, food, and fitness world. Dr. Lauren is a leading nutritionist, therapist, and functional medicine practitioner on a mission to help others thrive in their own lives, mind, body, and soul. And now, your host, Dr. Lauren Lax.
Well, hello. Welcome to another edition of the Break the Rules podcast, where we talk about quieting the noise in the health, food, and fitness world. And today we're having a hormone power hour with Dr. Stephanie Gray, who has so many credentials behind her name, but doctor of nurse practitioner, and just really in the functional space and integrative space, rather, integrating and blending conventional and functional approach to hormone health. And she is based in Iowa. She helps men and women build sustainable and optimal health and longevity so they can focus on what matters most to them. And a lot of her work, especially in hormone health, is based on her own story of having just infertility issues and multiple gastrointestinal issues and fatigue, you name it. She's been there, got the t-shirt. And so a woman after my own heart on that front. But Dr. Stephanie Gray, I'm really excited to just dive into the wild, wild west of hormones with you, talking some about progesterone today, understanding what that is all about, as well as the ceilings folks can hit in fertility. And I know you've experienced that as well, or infertility rather, and really some breakthrough insights that you've learned through that journey and now working with patients. So if you could just give us a little bit more background about who you are and what got you doing the work you're doing in the world.
Sure. So I do live in Iowa, like you mentioned, and I grew up in what I consider to be a pretty healthy family. I almost went to chiropractic school because I just grew up. Thankfully, I was very blessed that my patients always took us to the chiropractor and made us clean home-cooked meals, and we were always engaged in physical activity. So I feel like I had a really healthy upbringing, and I wanted to somehow, use that as far as determining what my profession would be long-term. And long story short, I ended up going through nursing program because I thought, well, nurses treat patients more holistically, and that's what I want to do. So I wanted prescriptive privileges so that I could also prescribe medications if needed, because I think there's a time and place for them. So I did gain those privileges becoming a nurse practitioner. And then I really started my own practice because I wanted to help patients get to the root cause of their problem and not just be prescribing drugs all day. And I feel like that's what a lot of my colleagues ended up doing. We need conventional medicine. We need what I like to call the fire department, who is here to put out big, bad, ugly fires in our health, but their tools are drugs and surgery. And I didn't want to only use those. I wanted to be more of a carpenter or a contractor and help patients repair and rebuild their body. And so I started my own practice, and that's what we've been doing since.
Yeah. And it sounds like you're pretty busy in the world of hormone health and space. Talk a little bit about just what got you more interested in that realm and that specialty that you are specializing in.
Sure. So I have had a long fertility journey, and, reflecting back on how painful my cycles were growing up, I probably should have seen this coming, but you always think, they won't happen to me. I won't have any challenges, right? So I had very heavy cycles, lots of cramps growing up. My parents took me to the chiropractor, and I was placed on herbs, various products, even fish oil and magnesium. I feel like we were ahead of the game back then, helping my cycles. But ultimately, that wasn't enough for me to be able to achieve pregnancy. And so it was really interesting owning a hormone clinic, not being able to achieve a pregnancy. It was heartbreaking because I felt almost like a hypocrite. I felt like, well, I can help others, but I can't help myself. So it was I had quite a few challenging years. I started the practice before I tried to achieve a pregnancy, but it was short after that I started having challenges. So I'll kind of go into that journey a little bit if you want me
please. To. I love that.
So because I have, this knowledge, I knew where my hormone levels were. I had been tracking basal body temperatures and ovulation, and I just could not achieve a pregnancy. And so I was pretty suspicious I may have endometriosis, as much as I didn't want to admit it. But again, knowing that I had that heavy bleeding, I thought, okay, there's a good chance I could have endometriosis. So I had the typical infertility workup. I went to a conventional doc. They did the test where they check out your tubes, HSG, to make sure everything was open. And I was told everything was fine there. Obviously, with conventional medicine, many patients are recommended Clomid, a drug to induce ovulation. But I knew in my heart I didn't have any problems with ovulation. I was, every month I had a surge with the testing I was doing at home. I knew I was ovulating, so I thought those drugs they can't be my answer. But that's what was first recommended to me. And interestingly, around the same time, sitting at my desk, I had a pretty stressful job. I experienced a really fast heart rate. And I share this story through my book, Your Longevity Blueprint. I ended up at Mayo Clinic, well, first in the emergency room, but then eventually at Mayo Clinic because I had tachycardia, which is a very fast heart rate. I didn't quite know what was happening to me, but I knew that conventional medicine's approach to that was taking a medication to control my heart rate. Same thing for infertility, right? They were recommending drugs. And I just knew there's more to life than taking drugs. I wanted to try to get to the root cause of the problem. So around the same time, I had tremendous need to belch. I had a lot of upper, I would say, gastrointestinal fullness and pressure. And when I would burp, I would just feel, I felt so much better. Could get rid of some of that gas. The gas was actually pushing on my heart. So I would get palpitations and fast heart rate if I wasn't able to belch. So I was starting to come to the realization that I had some other issues, not just fertility, but I had some gastrointestinal issues that I needed to improve and that those were likely connected. So I tested myself for celiac disease. I knew I had the genes for celiac for years, and I really was hoping I didn't have it, but I did. Based on my blood work, I remember that day looking at my results on my desk, and I kind of cried for like 10 minutes. I thought, shoot, this is me. This is happening to me. I had advised other patients to go gluten-free for years, but here I am. Now I'm the one that needed to go gluten-free. So it was a great learning experience for me. I did go see a GI doc, and I did have biopsies, and my biopsies were negative. So I didn't technically, meet the gold standard for full-blown celiac, but I was on the way. My blood testing was positive. I was on the way there. And interestingly, I knew I had gluten sensitivity, and I had probably been 80 to 90% gluten-free for 5 years at this point. But I needed to go 100% gluten-free. So I definitely went 100% gluten-free. And I also knew that alone probably wasn't going to be enough for me. I also tested myself for SIBO, which is small intestinal bacterial overgrowth, which was causing a lot of that gas. And I had a raging case of SIBO, which is more difficult to deal with than a gluten-free diet, in my opinion. So I did need to go on a low FODMAP diet. I removed a lot of the foods that are gas producing that was causing all that gastrointestinal fullness and shortness of breath and palpitations. And I started getting better, right? That was, I guess, maybe the first catalyst to kind of some lifestyle changes. Now, amongst all this, I was very stressed. So stress doesn't help anything. Stress is a very big hormone hijacker, I like to tell my patients. So in a man, it'll rob them of testosterone. In a woman, usually the first hormone to go is progesterone. Progesterone is the most important hormone for endometriosis. It's helpful for fertility. It's helpful for reducing heavy bleeding and cramps. And so I'm stressed out with a high heart rate, with gastrointestinal issues, and I'm trying to get pregnant, and I didn't have the hormones that I needed to achieve that pregnancy. So you can see the relationship between these two struggles. So around this time, my husband, who's our office manager at our clinic, said, I think you need to create some sort of blueprint for our patients because functional medicine can be so overwhelming. There are so many things that we can explore, from gut health to hormones to, I've been following some of your stuff online, Lauren, and it looks like you've been researching and learning a lot about mold toxicity. And
Wild West.
And interestingly, I think during all of these struggles, I was in a moldy building. Now, that's reflecting back because that was years ago, and that was before I knew about mold. But I think that was wreaking havoc on my body. And now I also test patients. I've learned a lot about treating patients with mold toxicity over the past few years. So I only say that to, again, come back to the point that my husband was suggesting I create some sort of blueprint for our patients to know that there are several steps to regaining health. Right? Health isn't regained overnight. It takes commitment from the patient. And so I wrote a book, Your Longevity Blueprint, where I'm essentially comparing how we maintain our home, right? We know to change the furnace filters and keep hair out of the drains and mow our lawn. We know there are things that we should be doing for our home, but we don't always know how to maintain our health, right? A lot of patients with infertility, they don't know what to do. They just go to their doctor and they may take the drugs because they're trying to achieve a pregnancy. And so through my book, I'm trying to outline a plan for patients to obtain the appropriate lab testing and find a functional medicine provider who can interpret those so that they can rebuild their body or rebuild their health. And this was a solution for me. And so I wanted to share that with others. And so that's really the summary and brief synopsis of my book.
So amazing. I think the universe takes us on our own health journeys as providers, even like both catalyzing us into being a provider and during our provider journey to continue to expand our practice and just learn and experience the best teacher. I would actually love to talk some about some of those pillars in your book that are so essential to health. And I just love how you compare it to a home of changing the furnace, or like right now, fully disclosed, I'm in an Airbnb because of a mold, like getting out of a moldy environment. And sure enough, we had some flooding in Austin last week, and there's water coming in underneath the door of this beautiful little Airbnb I have. And the folks don't know that they have maybe a mold problem accumulating, maintaining the home, kind of going back to that. And so it can be really easy if we're not fine tuning or, just like you said, changing the filters, et cetera. So talk a little bit about some of those pillars in your longevity blueprint that you find to be really essential for hormone health and really all health. Let's get real.
Well, let's stay on the mold topic for a minute here. So I have actually seen patients, and I should back up again and just say that again, I'm from Iowa. And if anyone has watched the national news, we've had huge floods in Iowa twice, which, I mean, the city that I live in, I mean, the entire downtown was underwater. And the first time this happened, we didn't know how to deal with it. And a lot of rebuilding has happened since then. But I think a lot of individuals are in moldy buildings and they haven't known for years. And when patients don't have respiratory issues, I think they think, well, then there can't be mold here, but there actually could be. So I have seen women my age with premature ovarian failure, meaning menopause level hormones, none, when they're young, 20s, 30s, from mold. So mold is a toxin that can literally knock out hormone production. And so back to those pillars, one of the pillars in my book is one of the last chapters is strengthening the roof of the home, which I compare to the immune system in the body. And so what falls under that is looking for chronic infections like yeast overgrowth or Lyme disease, or even mold. I put mold in that category. So I think it is important. Some patients know, oh, I've seen a little mold in my vent in my bathroom, or there's condensation on my window, or my sump pump backed up, or my basement has flooded. Those are cues that they should check their home for mold because that could be a driver of low hormones. So I have been I'm very thankful that I've seen many of those patients' hormone levels improve once they remove themselves from the moldy environment and we get them on mold binders and we treat them for mold. So that boils down to one of the last pillars in the book, which is really strengthening the immune system. Another really important pillar in that book that relates specifically to hormones is chapter 5, which is detoxifying the body. So I'm comparing the laundry room in the home to the liver and the gallbladder of the body. Just like how we have a constant burden of clothes that need to be washed and folded and put away, we have that same incoming burden of toxins into our body that we're constantly eliminating. And so mold could be one of those toxins, other chemicals. Again, I'm in Iowa, so herbicides and pesticides are floating around in the air. They're not just on our foods, they're literally in our air. So detoxifying the body is really important. My doctorate is on estrogen metabolism. So one of my passions is helping prevent things like endometriosis, which I had, fibroids, cysts, and estrogen-related cancers. And vegetables that are really important, which you probably talk about on some of your shows, are the cruciferous vegetables, broccoli, cauliflower, bok choy, kohlrabi. Those help our body clear out excess estrogen. It helps our body eliminate that so that we don't get estrogen congestion, which can lead to those conditions. So detoxing the body would be another pillar, really important for hormone optimization. And then fixing nutritional deficiencies is also important. That's the topic of chapter 4 in my book. So many women, because of poor gut health, have nutritional deficiencies, and we have to have enough fats to make our hormones. We have to have magnesium and selenium and zinc. So we don't want to be nutritionally deficient either. So I would say those are kind of the 3 top pillars when it comes to improving hormone health that I mentioned through my book.
Yeah. And I guess like sometimes taking the steps, like it's one thing to know what to do. I find in practice as a clinician, and then the implementation, like how do you really make it simple for folks, as far as it can feel like an overhaul sometimes to be like, oh, I just need to get more of these nutrients in and get out of the moldy environment. And just sometimes it can be overwhelming. And it seems like your approach with your book as well is really about taking like simple steps one at a time.
Yeah, and chapter 1 is chapter 1 for a reason. Chapter 1 is all about gut health. So I'm comparing the foundation of the home to our gastrointestinal system in the body. You have to have a strong gastrointestinal system upon which to build good health. So to simplify things, if you do nothing else, eat clean, avoid the inflammatory foods. That's what I had to do. Changing my diet first was the most important thing. And that's something that you can do even if you're in a moldy environment, right? You can start with simple diet changes, not poisoning yourself, but eating organic, eating greens, make a green smoothie in the morning. I think really improving gut health would be a great place to start for any condition, not just optimizing hormones, but really for any condition.
In your experience, like talk a little bit about just like with the fertility journey that you were on, what was like the time length that it took to start feeling different and seeing differences in your hormones? And
Sure. So my whole fertility journey from when we started to conceive to having a baby was 5 years. So, and that may be discouraging for some individuals. Um, I have seen many cases, many of my patients be able to conceive much earlier, but I have a long journey. I've shared a little bit of it, but there were so many things that I did need to work through, I think physically, but also mentally. It was just difficult for me to admit that I might need conventional medicine. There was a time in my life where I went down to University of Iowa and I did a consult for IVF, and I felt like a hypocrite that I would even be considering in vitro, but I wanted to have a baby. And I thought, am I going to have to go down this route? Thank God we have IVF for patients who do need it. But I had a lot of internal struggles just mentally that I needed to work through. Infertility is a battle. And I think it's something that I'm more comfortable talking about now. But when I was going through this, time just drug on and on and on. And it wasn't something I was comfortable talking about. When you track your cycles every month and you're not pregnant, and then you go to church and you're surrounded by kids, or even our small group for our Bible study at church, all the couples had babies. Everyone was getting pregnant, right? All my extended relatives were all having babies. And here I am owning a hormone clinic, really trying to work through, and my struggles. I have a strong faith. So just, talking to God, like, why is this happening to me? And in hindsight, I'm so happy that I've worked through all this. But I had some dark, deep times, right? When you're wondering why this is happening to you. So I think my journey took a while for many reasons because I had a lot to work through. But I'll try to make a long story a little shorter. I did not have to do IVF. I had consults twice. So my journey started in 2013. And by 2016, a couple years in, I thought I'll consider it. I ended up considering it a few years later as well. But one of the most important things that I needed to do to achieve a pregnancy was have surgery for endometriosis. Now, not everybody needs to have that. I had a very severe case. My appendix was compromised. I had sought out surgeons in other states because no one in my state actually had the technique that I wanted to have done to me. So I'll talk a little bit about endometriosis. Many times I'll say our local approach to that is scraping out the compromised tissue, but the recurrence rate of endometriosis is very high. It's like over 50% in a few years. And I had friends who had surgeries for endometriosis, and they had not been able to conceive. And I believe that they had scar tissue return pretty quickly. And so because I knew what I knew, I wanted a non-scarring technique. So I sought out some surgeons who were able to excise, literally cut out each of my lesions. I had a robotic surgery, very long 4 or 5 hour robotic surgery where they cut out every single lesion that I had, and they used a non-scarring solution as well. Their recurrence rate, something like 7% in 5 years versus the average 50%. So I feel very blessed and very lucky to have been able to seek them out for that surgery. all the while here, I was still eating dairy, and dairy is not good for endometriosis. And I knew I shouldn't have been eating dairy, but I was not dairy free. Dairy can drive up estrogen. It can cause endometriosis to come back. When we think of consuming dairy, obviously cows can be injected with growth hormone. Even if the food's not totally organic, I guess there still is a chance that there are mold toxins on the grains that the cows are eating. There are herbicides and pesticides that can be sprayed on the grains that the cows are eating. Again, there's plastic lining the milk jug. Not that I was drinking milk, but still cheese is dairy. And so I think the main two tickets for me, well, three that I should say that really helped my case. And again, every year I was kind of plugging in another piece to this. Was getting out of a moldy office. It was 6 months after I, changed office buildings that I was able to achieve pregnancy. So I'm pretty convinced that getting out of that office building was important. Taking care of my endometriosis was important. Going dairy free. It was 6 months after I went dairy free that I was able to conceive. And I was on progesterone. So I am a huge fan of progesterone. I use it in my patients for heavy bleeding and cramping. It many times reduces symptoms of endometriosis, especially in patients who are past the childbearing years, who just want to have more tolerable cycles, but they don't really need to have surgery. They're not trying to achieve pregnancy. So progesterone, I had been on for years. I failed to mention that earlier, but progesterone was really important for me as well. So every year I was plugging in piece after piece after piece to my fertility journey. And so it was a long journey. It wasn't like I figured this all out in a year. I had to work through a lot of things, and there are still more. But I think I pointed out the main pieces that I think impacted my fertility odds for the better. And lastly, getting my stress down was huge. I mean, actually making myself go to yoga every week was important. I could barely sit still when I first went to yoga. I'm like, what is this? I can't deep breathe. I'd rather go, run 5 miles. That was my personality. That's, running 5 miles was the opposite of what I needed at that time. I needed calming, restful, yoga in my life. And so plugging in all those pieces, I think really increased my odds. So it was a long journey, but it was well worth it.
Yeah, I love how you mentioned the stress piece, and just I think that's something we all have to come to exactly on our own. I was like you as well, and now I do yoga daily. I'm like, who is this girl? So that just, yeah, I guess there's not a panacea. I'm really happy that you share that, and that there's multiple things that you can do along the way to improve and better your health on that journey. I know too, before we started recording, you just mentioned progesterone is oftentimes a missing link, or just not maybe emphasized enough in its importance for our hormones and balancing it out. Tell us a little bit more about that.
Yeah, so I think because many of us do have stressful lives, we're constantly bombarded with various stressors. Stress is that hormone hijacker. So for one woman, maybe that stress is robbing her of progesterone, so she's now having premenstrual headaches. Maybe for another, if that stress is robbing her of progesterone, she's having heavy bleeding. And maybe for another, she's having anxiety or insomnia. I think because of the world we live in and the stress that some of us haven't quite admitted to needing to reduce, we're left with a low progesterone state. And so for my young patients, even in their 20s, I start checking progesterone levels. It's important to know if you want your progesterone level tested, that you really should test it during the luteal phase of your cycle, which in a 28-day cycle is the latter half, so between days 14 and 28. But specifically, I like to check levels 19, 20, or 21, kind of right in the middle of that luteal range, because that's when progesterone's supposed to be peaking. It's supposed to be its highest. So if we check it then and it's not high and it's low, Houston, we have a problem, right? We know that if it's low, then it's lower the rest of the month. So I think assessing levels starting in our 20s, 30s, 40s, 50s, we can track trends for patients, and we can let them know if their progesterone levels were dropping. I wish I would have had levels tested in my teens and early 20s, but I don't have that data. So I think that it is underrated how helpful it can be. Many of my patients who come to me with anxiety on medications, we're able to get them off just by optimizing their progesterone, whether we give them a bioidentical natural progesterone or we give them herbs to help boost their progesterone levels. I would rather have my patients on a natural hormone their body's supposed to be producing than other drugs that can be addicting and hard on the liver long term.
Do you ever see women that are not having their cycle at all? So whether it's like hypothalamic amenorrhea or obviously PCOS, and is progesterone something that you find to be helpful?
Yeah, so sometimes just giving natural progesterone will help induce a cycle. Obviously, with PCOS, many of those patients have higher androgens, higher testosterone, higher DHEA, and then lower progesterone. So herbs are a great way to start for these patients to minimize stress, to nurture the adrenals, and to help the ovaries produce more progesterone. So yes, I do see women benefit from taking it or taking nutrients to help them produce progesterone, and that help induce cycles.
And then when you talk about taking progesterone, like if someone is supplementing with it or using it, do you find oral versus topical, there's differences?
Yeah, so I use a variety of options for my patients. I like to meet them where they are. I have some patients who have many sensitivities and they would never tolerate a high dose of oral progesterone. We're using just small little doses of topical progesterone, and for them, that's enough. That's all they need. I have other patients who topicals won't do anything for their symptoms. They need a higher dosage, a different route of administration. So for many of those patients, we'll use a sublingual lozenge that can be compounded by compounding pharmacy, and then that's just placed under the tongue once a day. And then we also do use oral progesterone and sometimes even injections. That's something that before we started recording, I had told you, Lauren, I actually had to take progesterone injections through my pregnancy. My levels were so low. I mean, I literally, not just first trimester, the organization that was following me that I'm so blessed to have, they track my levels every couple of weeks, and I had to use progesterone injections my entire pregnancy, which is pretty rare, but that's, again, part of my more complicated journey. So there are various ways that patients can take progesterone, and that's determined by their levels. Sometimes even for infertility or patients who have had miscarriages, we'll use progesterone vaginally. We'll prescribe that in vaginal capsules or a vaginal suppository that can be compounded. So there are a lot of different ways that patients can take it. We just have to choose the best route for them.
Yeah, I love that you mentioned, meeting us where we're at, and that is so important for patient-centered care. Dr. Stephanie, where can people find out more about you, your work, as well as your book?
Sure. So my clinic website is ihhclinic.com. My book website, where blogs and my soon-to-launch podcast will be, is YourLongevityBlueprint.com. So I look forward to having you on my podcast, Dr. Lauren.
Sure. I look forward to you kicking this off. And we'll definitely put links in the show notes. And thanks so much for coming on and helping us shake up and break some rules in the hormone space today.
You bet. Thank you for having me.